They say good leaders should have commitment and initiative, critical thinking skills, and the vision to envision with. Now, you can be born a leader, a good one, but you can't be born a great one, because great leaders are swords which are forged in the fires of compassion, failure, and experience. They say good strategy should have clear definitions, long-term goals, and good gears in its systems. Strategies without compassion are good for the short term. However, we've seen many times in the long term, they're inefficient. For decades, some leaders kept their failing strategies the same, but is a strategy without capacity to change? With good leadership and strategy, magic can happen, but that only happens when there's no lack of compassion. The best leaders I've met were brave, peaceful, and gentle. Their benevolent traits are what I wish more can use. I'm not saying compassion is the be all and end all, but it should be prioritized in our list of core values. So let's maybe embed more compassion into strategy and leadership. And art, let's not forget art, because we're practically in need of it. I mean, when my depression eats my joy and leaves me hungry for happiness, please don't offer to feed me with a platter of pills. Instead, feed me poems of solace by Longfellow and Wordsworth. Feed me paintings of hope by David Tovey and John Pierre. Feed me stories of overcoming by Denise Harrison, and feed me photos of faith by Mitchell Sini and Amanda Sinclair. Feed me eco-friendly sculptures by Benji Lane, and feed me play scripts I resonate with by Lisa Hogan. Feed me Fashion from the Future by Benji Spear, and feed me Songs of Strength by Shalia. But please don't feed me too much meds when I'm down. But please do feed me as much art as you like. Which brings us to the question, what is art and creativity's role in a health crisis? Well, Arthur Rimbaud, renowned French poet, created rich, heartfelt art while fighting poor mental health. And Vincent van Gogh, I'm sure you know who he is. If he never painted whilst being a mental health patient, then we may have lost him much sooner than we did. There are phases when our minds can get overcrowded till we try to organize our thoughts, but can't find space or the time to gather our thoughts. But when we make art, the process can put us in a trance-like state. It's like a meditative space where we seem to find we have lower blood pressure levels and some peace of mind. Art can also give people a dopamine boost that can help chase away those low and bleak moods. Art can break language barriers. For example, if I was to say the word fiore, you may not know what that means. But I bet if I was to doodle a flower, you see the translative magic of art and its beautiful power. Art is good at sparking the stuff that is causing a joy-inducing, pain-reducing rush of endorphins. Creating art does something mysterious to the brain, where it helps us reduce the experience of our pain. There's been some interesting research, and what it suggests is that depression could slow down the healing of our wounds due to its psychoimmunologic effects. Well, art could shift our attention so that we're not as depressed, which seems to mean that art can benefit and ease the progress, the mindset, and speed of a patient's healing process, because art is a magician and wonder is its game. And we can feel the thoughts of happiness it conjures in the brain. This isn't complicated knowledge, so I must keep it simplified. Art can provide us with a much needed stimuli. It can make us stand and smile. It can make us sit and cry and help us greatly when we see a health crisis arise. Thank you.